What are patients' rights and responsibilities? And what is the most important patient right? And how do we protect patients' rights? Hello and welcome. I'm your host, Dr. Mosamtombene, and signing with us today is Trifosa Nzolengwe. On Vital Signs, we'll focus on patients' rights and responsibilities. Coming up on the program, we'll hear from a woman who is living with an autoimmune health condition called lupus. And we'll also hear from an aunt about her niece that got injured after being hit by a drunk driver. They share their experiences with us on how they were treated at healthcare facilities whilst they were seeking help. We'll speak to a general practitioner about the rights and responsibilities of patients, and then the National Chairperson of the Treatment Action Campaign about patients' experiences when they seek and receive healthcare. Lastly, we'll speak to the manager of quality assurance at the National Department of Health about Patients' Rights Charter, and of course, what rights are actually there and what you need to look out for when you're being treated at a healthcare facility. Do remember that you could be part of the show by asking the guests that we'll have on any question that you may have on your mind. Simply share your view with us on what we're discussing. The number to call is 011-714-0677, 011-714-0678. You can also share your thoughts with us on social media, on Twitter at SABC Vital Signs, and on Facebook, SABC Vital Signs. The show continues after the break. Stay with us. Welcome back to Vital Signs. I'm Dr. Mosamtombene, and today sikhuluma ngamalungelo wama-patient. Now, going to hospital for surgery or treatment can be very stressful, but knowing what happens when you arrive and understanding your hospital's admissions procedure can help you settle in. Tsakane Baloyi is living with an autoimmune health condition called lupus, which at times gives flares, and that results in her being hospitalized from time to time. Tsakane has been hospitalized more than 10 times because of her condition, and that has resulted in her gaining knowledge about her condition and, of course, how she needs to be treated when she goes to a health facility. She shares her experience with us, and, of course, Wandile Mufugeng, who's our producer. Take a listen.
Thank you so much for joining us on Vital Signs here on SABC News.
All right. Thank you for having me.
Now, Takane, could you just kindly talk to us with regards to you being admitted in and out of hospital? How many times have you been admitted into hospital? And what condition were you treating at that time?
Basically, with me being admitted in hospital, I've got lupus. It's a chronic autoimmune disease. So basically, I've experienced a lot of challenge having this lupus. And then luckily for me, I've actually experienced two sides of being admitted, two types of hospitals. I've experienced your private and I've also experienced your public hospital. I've been in hospital over 8 times actually, and I'd say that my experience has been different with both hospitals. Okay, so with private, I think the care is extra. They do what they need to do. They go the extra mile. They basically take care of you the way that you are supposed to be taken care of. And in my experience with your public hospitals, there, you'd sometimes feel like these people don't want to assist you at some points. They know that you are desperate, you don't have the funds to be in a private hospital, and then the treatment isn't so great, actually, I'd say.
Now, you alluded to the fact that as a patient, I don't know if it was on a private or public, that you demand proper treatment. Please talk to us about that experience. What is it that you felt that you were not getting from them, that you had to demand it from them?
If you come to me and you need to do something to me, maybe a drip, you need to insert a drip, or you explain to me, why are you doing this? Why is this required? Why this? So at some point, especially with your public hospitals, they wouldn't explain to you, okay, we need this from you. They just come, we need this from you, but you're not explaining what. Because I believe that with patients, also with doctors, you get to a patient, you need to explain, this is what you've got. this is what we need to treat you. These are the steps that we will follow to assist you in healing you. So at some point, I just felt like, no, you're sick. We don't need to explain anything to you. This is what we're doing to you, and that's it.
Talk to us with regards to the good treatment that you receive, or rather the bad treatment from both public and private.
I wouldn't really say much with the treatment because the people actually try, because they know maybe the type of people who are there would actually be able to complain and whatnot. So they try their level best to assist. Even if you do have any complaints, they attend to it as soon as possible. And then with your public hospital, you need to be a very vocal person.
In your experience, what do you think that needs to be done, or rather what needs to change with regards to health professionals being able to explain themselves properly to health workers? Because they would argue that they are busy, they don't have time to explain it to you, they need to rush to other patients.
It's very important for them to actually educate the patients, like have that time, because on a regular basis doctors do come in, seeing the patient during that process of coming in and checking the results and everything. Educate your patients, advise them, this is what you have. This is what we need to do to help you heal whatever that it is that you've got, just educate. And then if there's anything that they need to do, maybe x-rays and whatnot, give proper information. Tell them we're doing this because X, Y, and Z. Don't just, we need to do this. And the patient has no clue, why are you doing this? How will this help me? And so forth. So going forward, I think they really need to just educate their patients.
After the break, we'll hear from Eunice Motswane, the aunt of Lethabo Motswane from Soweto, who got injured after being hit by a drunk driver, about how she was treated at a healthcare facility. We'll also speak to Dr. Marlon McKay, General Practitioner, about the rights and responsibilities of patients. Stay with us. 16-year-old Lethabo Motswane from Soweto got injured after being hit by a drunk driver whilst playing in the street. Lethabo was quickly rushed to a nearby hospital in Soweto, and upon arrival, she was greeted by impolite staff members who thus resulted in a delay, of course, for her to get help that she actually needed. Her aunt Eunice Motswane spoke to producer Wandile Mfukeng about their experience. Take a listen.
16-year-old Lethabo Motswane from Soweto was unfortunately hit by a drunk driver in the streets while playing with friends. Her aunt tried to call an ambulance as quickly as she can, with no luck. They had to hire a car to take her to a nearby hospital. We visited them to find out if they got the help they needed at the hospital.
Lethabo was on the street there, in our street down there. She was together with some of the friends. I was here in the house. And later somebody calls me. Then I went out, but not telling me what is going on. Just call me. And then as I got to the street, that's when I found her on the floor, and they said,
Lethabo and her aunt Eunice Motswane were surprisingly not attended to as they got to the hospital. They were greeted by unfriendly staff, and it resulted in Lethabo not getting treated as an emergency patient.
As we got there, the first lady or attending, we found her a phone. So we wait and wait and wait. I was so bored because calling agent, she was talking to a friend.
After a long wait and the triage process, they were later sent to get x-rays. And to their surprise, they were not attended to and had to wait a while up until Lethabo complained of pain in her leg.
We sit there until one of the staff came. As she got there, they start talking, they looking at themselves, how beautiful they are, wara, 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 all those things. Fine. The other one came, I think, basebetsa baka 2-2, I don't know. So this, the first one that we found here, atsamaya. These two, they carry on with their topic. Topic ekon. Babua di taba tsa bona. We sit there until Lethabo scream, "Mom, just as those people pamfe di tablets, the painkiller." So I stand up and in front of them I said, "Lethabo, I don't know who's who, what's what."
After the x-rays were taken, Mom Eunice says they were given an envelope without any proper explanation. And because of desperation, they had to grab and ask one of the doctors they saw at the reception area to explain the x-ray results.
That doctor, I don't know, I'm busy waiting for the nurse. The nurse was on the phone. So Buse Are, but meantime, because you're not doing anything, you're waiting for that nurse to finish with the phone, and you're still waiting for the feedback or whatsoever. So meantime, while you standing here not doing anything, just look at the thing and tell me whether it's crack or. I'm asking that. But he said, no, her doctor will come and tell me. He says, please.
After a few interventions, Lethabo was not admitted at the hospital and was later taken to another hospital to get the operation she needed, and she is now in full recovery. Mom Eunice says the treatment they got was poor, and she feels like her daughter's rights to proper health care was violated.
I didn't get the proper help. I don't say they must jump at me. I'm not saying that. But you know, we trying, not fellow Oromoto who ignore and no, it doesn't work like that.
An annual physical examination ensures wellness and good health by monitoring vitals like weight, blood pressure, cholesterol, and other markers. Now, during your annual checkup, your doctor will review your past health history, evaluate your current health status, and of course, schedule appropriate screening and of course, examinations for physical, for blood, and other things. And of course, they may also draw blood and several lab tests may be done. But the big question is, do you as a patient ask for a full examination, and do you know what it actually entails? Does your GP explain thoroughly what your conditions are, and of course your diagnosis? Well, to chat to us, we're joined by a regular contributor to the show, Dr. Marlon McKay. Dr. McKay, thank you so much for joining us again.
Thank you very much for having me.
Good. So let's start off with the big question of looking at patient rights. So as a patient, are you allowed to walk into a private GP or a public hospital or a clinic and ask for them to check you out? You might not necessarily have a problem at that point in time, but you feel like you want to have a screening. Is this a thing that we do?
Absolutely. A patient is within their full rights to enter a medical facility and ask for a full checkup. Mm-hmm. And this is what we actually advise patients, and we encourage this. This is part of wellness medicine. In other words, we don't just want to see you when you're sick. We don't want to wait until there's something necessarily physically wrong with you. If patients can come in proactively, even before something comes in, and this is what we talk about all the time. Do you know your height and your weight and your body mass index? Do you know your HIV status, your glucose levels, your sugar, your cholesterol, your blood pressure? These are important numbers that every patient should know at any point in their lives. And so a patient is within their full rights to enter a medical facility of their choice and to request a full checkup.
Mm-hmm. Is this something that can be practically done in the country with the state of healthcare, with the number of health facilities, with the long lines at hospitals and clinics and things like that? Is it advised that patients just walk in and ask for a checkup even though they don't have any symptoms at all?
Yeah, I think on a practical level on what's happening, I mean, if you can just see my Eunice's story, even here's someone who was physically sick and injured, who needed attention, didn't get the right attention. So you can imagine, logistically, there may be issues if someone just walks in. Doctors may well say, or even nursing staff may say, listen, we don't have time for this, you are well, we have to deal with sick patients, and come back when you're sick or when there's something wrong. Don't waste our time. That is unfortunate and that is wrong. We should be able to make time. So practically speaking, in terms of what's going on in our health sector right at the moment that is so overwhelmed, it may not be possible. So I would encourage patients maybe to have a checkup at the clinic, the local clinic, or if funds do allow, maybe to see their local GP and try and get those things done.
What should patients do when they go for a consultation? What are the big things that we want them to know from a rights perspective when they walk into a doctor's rooms?
Okay, so I think just on a general level of principles in terms of what their rights are, they have the right to a safe environment within that medical facility. They have a right to informed consent. In other words, if the doctor wants to do something, the doctor must take the time to inform them and get their consent. The patient has a right to take part in the decision-making process. Now, traditionally, doctors have had this God complex. We tell you what's wrong. We tell you what you must do, not do. We write out a prescription. We say, go to the chemist, get this, and take this. No. Today, we need to talk to our patients and say, this is what you have. Let us talk about the different options available in terms of treatment, and let us come to a joint decision and a joint agreement so that we can take it. And diabetes is a typical example when you have to talk either with oral medication or with injectables such as insulin. The patient has to agree. We must get the patient's consent. The patient must be able to share in the decision-making process. The patient also has a right to refuse treatment. If I explain something, the patient is within their full right to say, doctor, I'm not happy with this. Doctor, can I get a second opinion? Those are the rights of the patient. And the patient also has a right to full knowledge of their health condition. They are within their rights. And again, doctors are very, very guilty of this. We say, I don't have time to explain everything. The patient is within their right. Doctor, if you are saying I have an autoimmune condition, if I have lupus, for instance, what does it mean? What does it mean for me? What's going to happen to me? What are the short-term, long-term effects? What happens if I don't take medication? What are the side effects of your medication? How long do I have to live? All these things, these are part and parcel of the patient's rights and responsibilities.
Now, before we continue the discussion, I think we've got Ruth from Johannesburg on the line. Hello, Ruth.
Good afternoon, team.
How are you, ma'am?
Can I carry on?
Of course you can.
Good and your doc. What happened to me was I went to one of the private hospitals here close to me. I went for a CT scan. What happened, I did not know they operate, the beds where they operate with the foot. I went for a CT scan. He explained all the pros and cons to me, the nurse. But at the end, he went to the other side of the window, I think, to look at the CT scan, whatever. But while he's on the other side, the bed was like high. And he said to me, ma'am, it's fine, you can get up and get dressed. Me not knowing the bed is so high, I got up and I fell off this bed. And I had a drip on, and the drip is out, and it was just blood all over. And the bed was high, and I fell. Yes, the nurse coming, running now, the male nurse running. Sure, what happened? I said, but you said I must get up and I can get dressed. I did not even want to complain about it because I fell on my head again because I'm suffering of headache. I fell on my head again. I did not even want to complain because I was thinking of somebody's job. Up until now, I'm still doing CT scan and still suffering of headache. And this male nurse is so nice to me up until today, because you think of somebody's job.
Well, thank you, Ruth. I think as a comment, I think we could walk away with something from that. So, Dr. McKay, the issue of patients going to facilities and then incidents occurring at the facility. I think a lot of the time, patients are told about it or they experience whatever it might be at that point in time. How should that issue be handled? I mean, with Ruth in her story, she explains that she didn't want to escalate the story anyway because, people's jobs and things such as that. But in terms of patient rights, what are your rights in that situation?
So Ruth has the right to complain. She has a right to complain that this happened. She's well within her rights to report the incident. And I think the incident will be examined and investigated appropriately, and someone won't necessarily have to lose their job because it falls within the scope. Things do happen and accidents do happen. And I think it's important that Ruth should have reported it in the sense that if there is any medical or recourse or legal recourse later on, there is a paper trail. In other words, there's documentation that shows that this happened, and these are the sequelae or the consequences of that, especially if there's, for instance, a head injury or ongoing complications or ongoing pain, as she still has now, these persistent headaches. So you don't have to consider the personal aspect or that concern, but she's well within the rights to have lodged a complaint and at least lodged an incident report documenting that this happened. It is not up to her to determine negligence. It is up to the superiors, whoever's in charge of that. But the patients must never feel that I'm too scared to complain because of what might happen. Those you are well within your right to complain about healthcare.
What are some of the biggest complaints that people find themselves having to put out with respect to healthcare? What are the ones that you've experienced in private but also have seen when you worked in state?
Yeah. Communication, doctor. You know, we don't set the time aside to explain to patients. We will give them a diagnosis. Patient is lucky if they get a diagnosis. They'll get a strip. No one will say, what is wrong? This is what is wrong. No one asks we don't give an adequate explanation. This is your diagnosis. This is what it means to you. This is what I suggest we prescribe for you. And these are going to be the side effects of the medications and the benefits of the medication and the pros and cons. And we never ask the patient, ma'am, sir, have I explained everything adequately? Or even, is there anything else that you would like to ask before you leave? Have I covered everything that you have come in for? We also don't, there's a lot of data now talking about the way we communicate, the language that we use. So we shouldn't say you are an HIV patient. No, you are a person who is living with HIV. You're not a diabetic. You're someone who's living with diabetes. So communication is adequate. One of the main complaints I get with patients, they come in and say, doctor, I've had this problem for so long, and everywhere I've gone, they've done all these x-rays, all these blood tests, and they keep on telling me there's nothing wrong with you, which is such an unfair statement to make to a patient. We should be saying, ma'am, sir, everything that we've done does not come up with a diagnosis, but you still have your symptoms, therefore we need to look elsewhere. But you cannot tell a patient who is ill or who has symptoms, there's nothing wrong with you, purely on the basis of normal bloods and normal x-rays. So we should be kinder, more compassionate, more patient with our patient, and more communicative in terms of the way we explain, the way we communicate and talk to our patients about what's going on with their bodies.
Before we let you go, we've got Toinette on the line. Good day, Toinette.
Hi, good day. How are you?
Very well, ma'am. How are you?
Fine, thanks. I'm actually looking at your program, and my son got lupus. He was diagnosed a few years ago. He was working, and they transferred us to a private hospital where there's a specialist that specializes in lupus. He's been having treatment through them. His work actually wanted to board him. The doctor didn't want to board him to say he can still work. So eventually he lost his job. Then he couldn't afford medical aid. We had to go to a government hospital. We had to go through the process all over again. And the doctor eventually got of his medical aid where we had papers. Eventually it showed that my son had a kidney transplant that he was charged from the private clinic, which never happened. And when she contacted the doctor just said he can't explain what happened there, and you don't know anything about it. Through the doctor's negligence and the clinic, they didn't give my son the correct treatment for the lupus. My son is now at a stage where he had already 5 biopsies on his kidneys, and he needs to go every month twice to the hospital. We don't get explained properly by the doctors what is wrong with him. They said he got lupus nephritis. His high blood pressure is going up. He's every second month actually in hospital. So what the lady said before, that you don't get the lady with the lupus, they don't explain you exactly what's happening to the patient, why is he taking 27 tablets, and what is the side effects. It's just his blood pressure is high. He must come in, the heart is not working properly, or the kidneys, and now there's something wrong with his liver, but they can't explain us properly what is wrong with the liver.
All right, I think we get it, Toinette, and I think it speaks to what you were saying, Dr. McKay, the fact that patients, private as well in public, find themselves in a situation where they get this diagnosis, but no one really ever explains. No one tells you why you're on medication and all of that. And I think the important thing here, more than anything else, is what Dr. McKay has said, is that you have a right to ask all the questions that you want to ask about your health condition. If it means you're stepping out and you're Googling to find out what this is so you can ask all the relevant questions, it is your right to do that so you can get all the correct information and know what's going on in your body. Thank you very much, Dr. McKay, for joining us today. We'll see you again very soon. And of course, it is now time for us to step on over and move to an ad break. Of course, the show continues where we are talking about patient rights right after the ad break. Welcome back to Vital Signs. Namhlanje sikhuluma ngamalungelo wenu ama-patient. Now, access to healthcare services is a basic human right as stipulated in the South African Constitution. Yet, a majority of patients who use public health facilities say they deserve to be treated with respect whilst accessing treatment at these facilities. Now, some feel that they're being stripped of their rights, which places their well-being under severe threat. To talk to us about what patients would actually want when they're seeking healthcare, of course, on a daily basis, we're joined by the National Chairperson of the Treatment Action Campaign, Mamsbongile Shabalala. Good day, Manijani.
Good day, Siyaphila Ninjani.
Siyaphila nathi. So, into engizokala ngayo ma is I want to find out, are patients informed about what their rights as well as responsibilities are when they go to health facilities?
Musa, honestly, we always try to inform patients and tell patients their rights, to say what is their rights, what they should do when they go to facilities. But we find ourselves as patient, and in most cases, patient not exercising their rights because of the conditions that they are facing every day when they go to facility. Patients have normalized to be abused by the healthcare system or by the healthcare workers and the system. So they always feel like when they go to the healthcare center, they need to bamukele whatever that is coming on their way because they are desperate for e-health. So which is not a right, and which is not, that is not supposed to happen like that. Everyone needs to feel free to go to health facility and then athole ezompilo ezifanelekile, but that is not happening in most cases.
Now, I'm sure there are many rights that the patients would have, but you have a few that you think are more important than others. Can you highlight some of these for us and how patients can use this information to achieve and receive the right kind of treatment at facilities?
Mostly important, as each patient's rights charter is saying, it's important for patients to access emergency services, which it's normally, that is not treated as an emergency in South Africa or by the health system. For instance, starting from calling an ambulance, if an ambulance will come after 2-3 hours, then that doesn't mean that it's still an emergency. And we are losing a lot of patients on the ground because the EMS or emergency services of our country is not responding to the needs of the people on the ground. And while you have taken by that ambulance after an hour or 2 or 3 hours, if you are lucky, you'll go to the hospital and you will sit at a casualty for almost 5-6 hours without being attended. And you will say that even if you are in pain, but if doctors and nurses feel that like you are not an emergency, they will put you aside and deal with what they think is emergency. Sometimes there is no emergency. They will just relax and do whatever they want to do and allow you to die or be in pain there. Like the story that we had earlier, where a young girl was led to be in pain for nothing because a person decided to be on the phone and the other one decided to compliment each other about their beautiness. That time, it's time when they need to provide services. And we experience that, Musa, a lot, especially also with pregnant women. Lately, we are receiving so many cases of pregnant women whose rights are violated, who are giving birth on the floor, who are operated wrongly, who are suffering after giving birth, as if sexual reproductive health and right in South Africa now it's a crime. So it's bad the way it's happening. The obstructive violence that is happening towards women, it's too much. The violence that is happening in hospitals, it's too much. So what is happening on the ground, it's really not what is supposed to happen. And as we always say, we have good policies, we have good strategies, but the implementation and the people who are providing services are not up to a standard of giving us the better services that we are supposed to get, not that we are made a favor to get, but it's a right, it's something that we are supposed to get, but we made as if we are beggars when we need a quality healthcare on the ground.
And of course, the right that pops up when you think about patients and them going to facilities is the choice or the right to choose health services. It's very difficult when you're working with a referral system for patients to say that they want to skip the local clinic and they want to go straight to a quaternary hospital because we have a referral system that works in between. How do patients then navigate that system where they feel like they're not getting the help that they should be getting at a local clinic, but they want better help elsewhere? How would that and how should that be managed?
In most cases, yes, we see people not wanting to follow that system because of the challenges that we are just labeled to say people are not treated well at the primary healthcare. So a patient will rather say, let me go and sit at the hospital the whole day so that I get services that I need to get. But in most cases, we find patients faking address or taking wrong addresses and register those wrong addresses to other hospitals or other clinics where they feel like the treatment is better than their local clinic, which is problematic at some point in most cases, because when the healthcare workers needs to follow up with cases, then it's difficult, because when you go to the address that the person has registered, it's difficult to find that person there. And sometimes when there's an urgent need for a patient maybe to contact the family, you find that the person is coming from far away. I remember the other time I was watching one of the channels here where people were telling us that they are coming from as far as Heidelberg, Northwest, to go to Barra to access services. And for them to get there, they will have to take any address from Soweto or around so that they can be accepted at Barra and be given healthcare services. So that shows the level of frustration that people are facing on the ground. But what we believe that can be done, there is still a room for improvement, and we still have to educate patients to say it's important to use your local clinic, but then also engage with healthcare workers to say, how are we supposed to treat patients, and how do we supposed to make patients feel comfortable to go to the local clinic so that the process can go easily and it make easily for everyone, and everyone's job that doesn't have to be oppressing or feel like desperate or feel like we are oppressed and you have a burden of providing services while people are not coming from this area and are not right people for that level of healthcare. We understand that, but patients, because of frustration, because of desperation, they end up not ignoring whatever referral systems that are there in the country, but wants to get what they want to get, because at the end of the day, everyone wants to live.
What's the main complaint that you have from patients that, end up informing you about, and how are you working towards solving this issue?
Most of the complaints are coming from people, especially from the primary healthcare, where patients are turned away for cannot honoring their appointments because of various reasons. We know that we are living in a country that has low employment rate and people are struggling to survive. Sometimes they are taken back to the queue. Sometimes they are shouted at by the nurse, and sometimes they are made to feel uncomfortable when coming to the facility, especially the key populations. We know that sex workers, when they go to a facility, especially if they are known, then they'll be treated as they are unhuman women, because of the work that they are doing, LGBTI community, they will be often asked to say, how do we treat you? Are we treating you as a woman or as a man? Because we don't understand. Especially trans people, when they come, they will start be stigmatized from the gate, from the security to the healthcare worker in the consulting room. At the primary local, that's mostly of the cases. But at the hospital level, most of the cases are attitude of staff, women not getting treatment, especially those who are giving birth, people being kept at casualty for 2-3 days without bed, sometimes sitting on the chair while they are sick, and sometimes they are not provided enough food and they are not given treatment. So there are a lot of cases, and the way it is, Musa, it's really frustrating because we know that people, they don't have to suffer like that, and we don't understand why people are not honoring what they've signed up to do. Because when you are a healthcare worker, you are signing up to say, I'm going to provide services. You are giving yourself. And it's not like, I want to say this, Musa, because sometimes healthcare workers feel like we are always speaking negatively about them. There are people who are doing right, even in the public sector. There are nurses, there are doctors who are committed to their work. And we honor them, we encourage them. Yesterday, we had an event, Kwamashu. One of the community members stood up and said, can you please congratulate or honor one of the nurses of the mobile clinic, Sister Magwaza? And we were happy because there are people who are still committed to their work and providing services on the ground. And people appreciate that.
I'm going to have to jump in there, but I think your point has been received, that in as much as there's all this wrong going on, there are people that are also doing their job. But it's important that those that aren't doing what they're supposed to do jump on the bandwagon and provide patients the appropriate care that they deserve. That was Mam Sibongile Shabalala from the Treatment Action Campaign joining us today. Thank you so much, Ma. We will continue, of course, after the break, as you've seen, as a manager of quality assurance at the National Department of Health, as we look at what the Patients' Rights Charter looks like. We'll see you after this. Welcome back to Vital Signs. Comprehensive healthcare is a joint responsibility between the patient and the medical team. Now, to achieve better health results, patients must understand their illness, follow their treatment, and discuss any concerns or disagreements that they might have with the healthcare workers. Now, to ensure all South Africans have access to basic healthcare, the Department of Health is using the Patients' Rights Charter to uphold, promote, and of course, protect the rights to effective health services. To talk to us about the Patients' Rights Charter and what patients should know and do when they're being treated at healthcare facilities, we're joined by Mam Annie Jaute, who is the Manager of Quality Assurance at the National Department of Health. Thank you so much for joining us, Ma'am.
Thank you, sir.
Good. I think let's start off with what the Patients' Rights Charter is. Can you briefly explain that for us?
Thank you, thank you, Musa, for having me. What I can say, the Patients' Rights Charter is actually a document that has been developed and published by the National Department of Health after being guided by the Parliament. The Rights Charter are actually...
Mam Jaute?
Yes, sir?
Yes, we can hear you.
Okay, can you hear me now?
Yes.
Thank you. The Patients' Rights Charter is a piece of document that has been developed by the National Department of Health. Am I audible?
We can hear you perfectly clear, ma'am.
Okay, thank you very much. And the whole purpose of this document is to ensure that patients understand what is their rights as well as their responsibilities when they come to public and also private healthcare facilities. It is very important for the patient to demand these rights when they are in public health facilities, as well as in private healthcare facilities. But they can only be able to demand these rights when they know these rights and they understand what they mean when they get to our public health facilities. But we should not forget that when we look at both public and private public health facilities, there is a slight difference, because in public healthcare facilities, we are confronted by high numbers of patients coming to our facilities and needing care. This has the few number of staff members and resources, as compared to the private healthcare sector, where there are abundance of healthcare facilities, because that's where services are provided when a person is able to pay. So it is very important for the rights to for every patient to have access to healthcare services and to be treated by a named healthcare provider. Also to be treated in a safe and healthy environment, and also be informed of their diagnosis, as well as the plan or the treatment that has been decided on by those that are providing care, and also be given opportunity to participate in decision making, and also to ask questions. And where a person feels not fully answered or is not happy with the guidance that or information that they receive from those that are treating them, to be given an opportunity to get a second or further opinion concerning their health conditions. But it is very, very important for them to be informed by those that treat them. Also, the patient need to be given to give a consent for certain treatment, particularly those that require operations and the like. And also the patient needs to be treated in private, and her confidentiality or his confidentiality needs to be treated, to be respected, I'm sorry. And they need to be treated in a very respectable manner, irrespective of their ability to pay, their sexuality, or otherwise. They just need to be, they have to be treated as such. But what is also very important is that when we see patients in health facilities, most of patients are very reluctant to voice their dissatisfaction with the health services that they receive. We've got various methods of monitoring whether these rights are respected, and such need to be communicated to us, as we'll be explaining later on, hopefully.
So what's the process of someone having a complaint or having their rights not being met in the way that they feel they should be met at a facility? What's the step that they need to take?
Okay, firstly, when patients come to our facilities, they need to know their rights. And as the department, we've made sure that the rights are published all over, including also translated in the official languages of our departments. They've got to be available. They've got to be accessible for patients to know them. When the patient feels that their rights are not respected, they need to lodge a complaint at that facility. They need to look for a manager of the department, of that facility, and lodge such complaints where they feel that their rights are not respected. Where they do not receive any joy from a local facility, we've created a departmental app for complaints and compliments and suggestions. So anybody can just download that app from their phone, and they lodge that complaint through that app. The beauty of the app is that everybody from the level of the national department, from the province, the district, sub-district, and facility will see that complaint. And immediately when the patient has lodged the complaint through that app, they will get a response of acknowledgement of that complaint. And everybody throughout the lines or the levels of healthcare services will see that the complaint is being attended to. Even the patient will receive notification that so-and-so at the certain facility is attending to your complaint. If such complaints are not attended to, the province should make sure that they are attended to. We at National also, on regular basis, we follow up on those complaints, and we make sure that they are being attended to as soon as possible.
All right, we've got Yasmin from the Western Cape on the line. Good day, Yasmin.
Hi, good day. I just want to say thank you very much for this informative program. I just by chance watching it, and everything that your guests have been saying is what I have experienced at the hospital. But I don't know, you just don't want to make that formal complaint there because of the level of service you already get there. You just don't have the, to make that complaint. But thank you very much for the show. Next time I'm treated that way at the hospital, at the day hospital or a government hospital, I'll definitely lodge a complaint. That has inspired me very much.
Thank you very much, Yasmin, for that compliment. We aim to give you what you need to know so that you're informed and are able to look after yourself and know what your rights are. To continue our discussion and before we wrap things up, I would like to know, do doctors or nurses or healthcare providers just in general have their own rights and responsibilities when it comes to treating patients?
Yes, we are living in a country where everybody that is in the country have got certain constitutional rights, and we are saying that as the healthcare providers, we've got to respect the rights of the patient so that in turn we can also get or receive the respect that we want. Yes, we've got the rights to be treated with respect, but as well we need also to provide care with respect to patients that we are providing. We also need to have resources as we provide healthcare services so that we are able to provide the care that is required by the patients. But in the absence of resources, it becomes very challenging. And even when we compare the numbers of staff with the number of patients that are coming to our facilities, it at times becomes very challenging, and that is seen as a way of undermining the rights of the staff members that are providing the services. But what is interesting is that the department is doing its level best to ensure that there is equal access and respect of all the services. Right now, we are in the process of ensuring that access is equal in both public and private healthcare sectors through the implementation of national health insurance, where all patients will be seen, where the spread of healthcare staff members will be equal. And we believe that once that has been introduced, care will be better. But we are not condoning the fact that within the healthcare sector, there are those other staff members that are doing their level best to respect the rights of the patients. And those that are not respecting the rights of the patient need to be known and need to be communicated by patients so that they can be addressed and dealt with speedily.
Well, thank you very much, Ma'am Annie, for joining us today and really highlighting what the National Department of Health is doing with respect to quality assurance and making sure that the patients know what their rights are and are able to receive all the things that the rights say they should be receiving and know how to take up complaints and things such as that. Thank you for joining the show, and we hope that we've left you with little nuggets that you could take home with you so that the next time you have to interact with someone in the healthcare sector, you're able to stand up for yourself if you feel like you're being treated unfairly. And of course, thank you to all the guests for joining us. I'm Dr. Mosamtombeni. This is Vital Science. We'll see you again next week.